Hey guys, I'm really glad to see you and welcome to Medic Mind's video series on the medical interview. For those of you who don't know me, I'm Aniket and I'm a 5th year medical student at UCL. And in today's video we're going to tackle one of the most common topics in medical interview, the work experience. Whether it's a panel interview or an MMI station, you're pretty much guaranteed to be asked about work experience. My first tip is to be aware of the common questions on the work experience. Questions about work experience can come in many different forms. Sometimes they may ask you directly about the work experience. For example, if they ask why medicine, it's a good idea to link your motivation for medicine through your work experience. And at other times, they might directly ask you about your work experience through common questions like, what do you learn from your work experience? Discuss a memorable patient. What qualities did you see in doctors? And much, much more. My second tip is to be as reflective as possible about your work experience. There are some big no-nos for work experience questions. First of all, don't be overly optimistic or in awe. You want to come across as a realistic person, and it can be useful to throw in some negatives of medicine that you saw alongside the positives, because it makes you seem logical, rational, and genuine. Also, don't overuse buzzwords such as MDT and empathy without any substance. Now, these are great terms, don't get me wrong, but only in the right context. And when discussing your experiences, don't just list what you saw. This can come across as dull and it seem like you didn't really enjoy yourself. Instead, try to be reflective and actually discuss what you saw, what you liked and what you learnt about medicine. Now we'll go through how to discuss work experience in surgery. When you talk about your work experience, don't be too generic. Pick a specific placement, whether it be in surgery, in a GP practice, or in A&E. If you're talking about surgery, it can be useful to talk about teamwork. You might have seen a multidisciplinary team consisting of surgeons, nurses, physiotherapists, and the anaesthetic team. Each healthcare professional has a different role in the patient's care, and it's really interesting how they interlink and work together. It may also be interesting to talk about manual dexterity. You might have realised how important it is for surgeons to be meticulous and precise in operations, and if you like things like art, it might be a good idea to link this in at this point. There are many more things you can say about surgery, and to be honest, it all depends on your specific placement. But hopefully these examples can give you some hints. So now, on to work experience in a GP practice. Again, let's discuss some interesting things you might have seen. Some of the things you may have seen could include having exposure to the managerial side of the GP practice. If you spend time at the reception, you may have learnt the timetabling system they use to manage patient overload, or even how the GP practice adjusts its approach in different seasons, with the winter months being particularly difficult. You may have also observed the time efficiency needed in a GP practice. The practice is likely to have had a telephone triage system, which helps to assess the severity of a patient's problem. By prioritising, the practice can make sure that the most urgent patients are seen first. Also, during short 10-minute appointments, it could have been interesting to see how the GP finds an intricate balance between time efficiency and patient care. It's quite a tough act, as a GP needs to be a good listener, a meticulous note taker, and has to potentially diagnose the patient and prescribe appropriate drugs all within 10 minutes, without making the patient feel rushed. There are other things, of course, such as continuity of care in GP practices or the referral system, linking in different sectors of the healthcare network. All I'm saying is that it should be reflective and not descriptive. And finally, let's discuss hospital medicine. In your interview, when you discuss hospital medicine, there's probably 100 things you can talk about. You may focus on how interesting it was to see a doctor take a history, or how a doctor is so time efficient, yet balances asking very open and at times very specific questions. It may have been intriguing to see the importance of a past medical history, lifestyle factors and family genetics in the diagnosis of a condition. I remember in my work experience, I was fascinated by the doctor-patient relationship. I always used to think of medicine as being very scientific, which of course it is, but in my hospital placement, I saw how doctors took a holistic approach, holistic meaning whole. I saw the importance for doctors to have a good bedside manner, good communication skills, and in general, an approachable attitude. So, there you go, we've discussed a lot of things, and I'll summarise. It's important to know your work experience placement inside out. You should be able to speak for at least 3 to 4 minutes about each of your placements, whether it be GP or a hospital experience. And it's really important to be reflective and discuss a few points in detail, rather than just listing lots of points with no personality. Thank you for watching, and make sure to check out my other videos on MMI mock stations, tips for MMIs, tips for panel interviews, and things to do in a medical interview, and much more.
Thanks for watching. Click here to sign up for one-to-one tutoring with insider university knowledge, guaranteed improvement, and a personalized experience. Get your medicine offer today.